Hello, my name is Evelyn, and I'm going to present to you the disease called tuberculosis. Tuberculosis, or TB, is a contagious infectious disease caused primarily by the bacterium Mycobacterium tuberculosis. It is classified into two main types. The first is pulmonary tuberculosis, which affect the lungs, and it is the most common form. The second is extrapulmonary tuberculosis, which involves other organs or tissues in the body, such as kidneys, spines, spine, bones, lymph nodes, or the brain. But not everyone infected with the disease becomes sick. That is what we're going to discuss on the next slide. There are two conditions related to tuberculosis. They are the inactive TB or latent TB infection and the active TB disease. Latent TB infection is a condition where a person is infected with the bacteria that cause tuberculosis, but the bacteria remain inactive in the body and do not cause symptoms. While the active TB disease happens when the Mycobacterium tuberculosis is actively multiplying and growing in the body. So in latent TB infection, the bacteria are present but inactive, while in active TB disease, the person is sick and can spread the bacteria to others. Let's discuss a little more about the latent tuberculosis infection. In latent tuberculosis infection, there are no symptoms. People with latent TB infection do not typically feel sick or exhibit symptoms because the bacteria are not actively multiplying. It is also not contagious. Individuals with the infection cannot spread the bacteria to others. But how do we know if we are infected with latent TB? Latent TB infection is usually detected by a positive result on TB skin test or blood test. Do we get treatment? Yes, treatment is needed. Even though there are no symptoms, treatment is recommended to prevent the development of active TB. So remember that a person with inactive TB infection cannot spread the bacteria to other people. And you do not need to be tested for TB if you have spent time with someone with latent tuberculosis infection. However, you should be tested for TB if you have spent time with someone with active TB disease, which we are going to discuss on our next topic. Active tuberculosis disease occurs when the immune system cannot keep TB bacteria from multiplying in the body and causing symptoms. The most common signs and symptoms of the disease are a cough lasting more than 3 weeks, sometimes with blood-thin sputum. Mm, Discomfort or pain in the chest, especially when breathing and coughing. Low-grade fever and sweating at night. Noticeable weight loss without trying, often due to decreased appetite. And general feeling of tiredness and lack of energy. Other possible symptoms are less common, such as shortness of breath. If TB is outside the lung, it may cause a firm red or purple swelling under the skin, back pain for TB disease of the spine. If kidneys are affected, there is blood in the urine, and TB meningitis may cause headache and confusion. As we discussed earlier, Mycobacterium tuberculosis is a type of bacterium that causes tuberculosis or TB. It is a rod-shaped, non-motile bacterium with a thick, waxy cell wall that makes it resistant to many common disinfectants and antibiotics. TB is spread through the air when people with active TB in their lungs or throat cough or sneeze. The bacteria can stay in the air for several hours and are more likely to spread indoors or to places with poor air circulation. So people who breathe this air can be infected with TB. So once inhaled, the bacteria can settle in the lungs and begin to multiply. TB bacteria are usually inhaled into the lungs when they are engulfed by the alveolar macrophages. The immune system responds by sending more immune cells to the site, forming a granuloma. It is a cluster of immune cells that walls off the bacteria. I'm sorry about that. The immune system may contain the bacteria, leading to a latent infection in which in most people the bacteria remain dormant within granulomas. But if the immune system weakens, the bacteria can become active, causing disease. So that is the active tuberculosis. Then active TB leads to tissue destruction in the lungs, forming cavities and causing symptoms like cough, fever, and weight loss. And if not contained, TB can also spread to other organs, affecting the lymph nodes, bones, brain, and more. But what are the risk factors for getting tuberculosis? Here are some risk factors for getting tuberculosis. Living or working with someone who has active TB significantly increase the risk of infection. So healthcare workers are at higher risk of getting or developing the active TB disease due to potential exposure to TB patients. Also, working in places where TB is more likely to spread, like working in a hospital, homeless shelter, correctional facilities, and in nursing homes. Some people with weakened immune system due to conditions like HIV or AIDS, diabetes, severe kidney diseases, and certain cancers are very susceptible to developing TB disease once infected. Also, some medications they are taking can weaken their immune system and increase the risk of developing the active TB. Geographic location is another risk factor, like being born in or frequently traveling to areas or countries with high TB rates, particularly in parts of Africa, Asia, and Latin America. I was born in the Philippines, and the Philippines is known as one of the countries that has a high rate of tuberculosis. So the Bacillus calmette-guerin, we also know that as the BCG vaccine, is part of the routine immunization in the Philippines, given to infants at birth or anytime after birth. Okay, let me discuss more about the BCG vaccine. Bacillus calmette-guerin, or in short, the BCG vaccine, is a vaccine primarily used to prevent tuberculosis in countries where TB is common. It is a live attenuated vaccine made from a weakened form of Mycobacterium bovis bacteria, which is similar to the bacteria that cause TB. The vaccine was developed by French bacteriologist Albert Calmette and Camille Guerin, and they named it Bacillus calmette-guerin, or BCG. I feel like it took them over like 13 years to develop BCG, like from 1908 to 1921. As I mentioned earlier, I was born in the Philippines, and shortly after birth, I received the BCG vaccine as part of the routine vaccination in my home country. I remember asking my mom about the scar on my left upper arm, and she told me it was due to the BCG vaccine I had right after I was born. But remember, even if you receive the TB vaccine, you may still be at risk for TB infection. However, this vaccine is not widely used in the United States due to the low risk of severe TB and its potential impact on TB skin test accuracy. In other words, it can cause a false positive TB skin test reaction. There's no reliable way to distinguish a positive TB skin test reaction caused by the BCG vaccination from a reaction caused by true TB infection. So let me tell you a story about a false positive TB skin test result after I discussed the TB diagnosis. Okay, so tuberculosis is diagnosed through a combination of clinical evaluation, laboratory tests, and imaging studies. Common diagnostic methods include clinical assessment, where doctors usually look for symptoms such as persistent cough, fever, and night sweat, and weight loss. Next is the TB skin test. It's also known as the Mantoux tuberculin skin test, TST, or sometimes they also call it the PPD. With this skin test, a small amount of tuberculin purified protein derivative, so that what PPD stands for, solution is injected under the skin. If a raised bump or induration appears after 48 to 72 hours, it may indicate TB exposure. Usually, a healthcare provider will measure the induration in millimeters, and the size of the induration will determine whether the test is considered positive or negative. Induration of 5 millimeter or more is considered positive, and no induration or a very small induration less than 5 millimeter is generally considered negative. Blood test, interferon gamma release assays or IGRAs, measure the immune response to TB bacteria in the blood. IGRAs measure the immune response to whole blood after mixing with controls and synthetic peptides that are designed to stimulate TB antigens. If a person is infected with TB, their white blood cells will react due to sensitivity to antigens, and it will release interferon gamma. So the test measured the amount of the interferon gamma response. Sputum test. Samples of mucus from the lungs are examined under a microscope and cultured to confirm active tuberculosis. And the chest X-ray, a chest X-ray can show lung abnormalities that may indicate TB disease, such as infiltrates or cavities. Okay, so now we know how tuberculosis is diagnosed. Let's go back to the story of a false positive skin test. When I was applying for CNA, a two-step tuberculin skin test or the TST was required. Usually in screening healthcare workers, a two-step TST may be performed to ensure more accurate results. I took the first TST and I got a negative result. After a week, I went back to the hospital to get the second TST. And after 48 hours, I came back for the result. After showing my arms to the nurse practitioner in charge, she told me that it was positive. I was shocked and immediately called my sister, who is a nurse, and hoping she could help me figure out what was happening. She reminded me that I was vaccinated with BCG, and she explained how it interfered the interpretation of the TST, and it could be a false positive result. So I requested for a chest X-ray, and after an hour, I got a result, and it was negative. Thank God. All right. Management of tuberculosis involves a combination of medical treatment, monitoring, and public health measures to ensure effective cure and prevent the spread of the disease. TB is diagnosed using a combination of clinical evaluation, TST, chest X-ray, and sputum smear microscopy. The standard treatment for active TB involves a multi-drug regimen, typically including isoniazid, rifampin, ethambutol, uh, and pyrazinamide for the initial phase, followed by a continuation phase with fewer drugs. Treatment usually lasts 6 months or longer. To ensure adherence, healthcare workers may supervise patients taking their medication, which helps prevent drug resistance. Regular follow-up is necessary to monitor for side effects, assess response to therapy, and check for complications or relapse. And for the prevention, BCG vaccination, screening of high-risk populations, isolation of infectious patients, and contact tracing to prevent further spread. There are several treatment plans for inactive TB in the United States. They are safe and effective. The treatment plans for inactive TB use a combination of medications like isoniazid, rifampin, and rifampicin. Um, the 3 and 4 month treatment plans are preferred because they are shorter. So we have here the 3HP, which means 3 months of once weekly isoniazid plus rifampicin. And we also have here the 4R, means 4 months of daily rifampin. And we also have the 3R, means 3 months of daily isoniazid plus rifampin. Then if 3 or 4 months treatment plans are not right for you or it's not available, then 6 and 9 month treatment plans, is recommended. So 6H means 6 months of isoniazid and 9H means 9 months of isoniazid. Treatment plan for active TB can also take 4, 6, or 9 month treatment plans, and it also uses combinations of medications such as the ethambutol, isoniazid, moxifloxacin, rifampin, rifampicin, and pyrazinamide. However, the healthcare provider will discuss to the patient which treatment plan is best for the patient, depending on the health history or if there are any other medications taken by the patient. The healthcare provider will make sure that the medication will kill the bacteria in the patient's body. So, with proper treatment, most people affected by tuberculosis can survive with a high success rate of 90%. However, if not treated, it can be deadly with mortality rates of 50%. Early diagnosis and timely treatment are vital for positive prognosis. TB is one of the top 10 causes of death worldwide, with millions of new cases each year, especially in sub-Saharan Africa and Southeast Asia. So understanding the epidemiology of TB helps in designing effective public interventions to reduce it from spreading. Let's now learn about a little bit of history of tuberculosis. Let's watch a short video on the history of tuberculosis by the Microbiology Society.
Tuberculosis, a contagious infectious disease caused by the bacterium Mycobacterium tuberculosis. Today, TB is one of our deadliest diseases, killing over 1.5 million people a year. But how did it get to this stage? What's its history? TB has had many names over the centuries. This is scrofula, the White Plague, consumption, but the earliest physical evidence in humans can be traced back to 9,000 years ago. Archaeologists found TB in the remains of a mother and child in the ancient city of Atlit Yam, which is now under the Mediterranean Sea. Historians can often trace diseases through written accounts, and the first recorded mentions of TB in writing were in India, 3,300 years ago. There were continued mentions of TB throughout the ages, including the Greeks, who named it phthisis. During Europe's Middle Ages, people were trying some rather interesting cures for TB. It was thought that the royal touch could cure the disease. Starting with Clovis, king of what became France, in the year 496, thousands of people were touched by monarchs over hundreds of years. The practice continued in Britain until the reign of Queen Anne, which was when the disease really took a hold. From the 1600s to the 1800s, TB caused 25% of all deaths in Europe and the United States. Death rates in major cities were approaching 1,000 deaths per 100,000 people a year. Society often responds in strange ways. In Europe, the disease was romanticized. TB was very prevalent in poets and artists at the time, and the pale, pallid faces caused by TB were thought to be attractive. In early 19th century New England, the response was rather different. TB, or consumption as it was known, was thought to be caused by vampires. As the infection spread quickly through families, people believed that this was due to the deceased TB sufferer draining the life from other family members. It even went as far as bodies being dug up and burned to stop the vampire from attacking and preventing the spread of the disease. Throughout this time, scientists were struggling to work out what caused TB. Was it inherited or infectious? This all changed on March 24, 1882. German scientist Robert Koch demonstrated that TB was indeed a bacterial infectious disease. This and other scientific advancements led to the development of the BCG vaccine in 1921, which is still used today. TB's long history hasn't ended. The fight against it is still ongoing, but it is hoped that continued advancements in antibiotics, diagnosis, and vaccines will help make TB history.
So TB has exhibited epidemic characteristics due to its widespread infection rates. All right, let's learn more about tuberculosis. Do you know what sanatoriums is? All right, so TB sanatoriums were places where people receive treatment for TB disease away from their homes. It is to reduce the risk of spreading the bacteria to their friends and family. Before antibiotics, isolation and proper nutrition were the best cure for tuberculosis. In 1875, Joseph Glitzman opened the first sanatorium in the United States. Then in 1884, Edward Livingston Trudeau, who had tuberculosis himself, opened the second sanatorium in Saranac, New York. In 1904, the United States had 115 sanatoriums that grew to 839 sanatoriums in 1953. So today, the United States no longer uses sanatoriums, and people with tuberculosis usually receive treatment from healthcare worker. Famous people who died due to TB or tuberculosis. On July 4, 1831, John Monroe died at age 73 from heart failure and tuberculosis. And in 1960, Eleanor Roosevelt was diagnosed with aplastic anemia, and in 1962, she was given steroid, which activated a dormant case of tuberculosis in her bone marrow, and she died at age 78. And that is all. Thank you very much for watching.